I'd like to welcome you to today's webinar. Considering April is Alcohol Awareness Month, and we are all thinking about strategies to help prevent the misuse of alcohol and support people as they look for intervention and treatment options, I think this webinar is particularly timely. I do want to welcome all of you again. The title of this webinar today is RecoveryRachel, a new era in mental health and addiction access. This is a groundbreaking resource for individuals, and I'm looking forward to hearing more about it today. I do want to introduce our speaker, Jennifer Lloyd. I first met Jennifer, it's been some time ago, when I was working in Stark County with Drug-Free Stark County, and she was working in the Attorney General's office. So it's nice to reconnect with her through the Recovery Ohio initiative. But please let me introduce Jennifer. She is the Assistant Director for Recovery Ohio, an initiative within Governor Mike DeWine's office, focused on coordinating and expanding efforts to address substance use and mental health disorders. Her work includes enhancing prevention, expanding treatment, and supporting recovery services, as well as partnering with law enforcement to combat illicit drug activity. Previously, Jennifer served as the Central Ohio Territory Business Manager for Alchemies Incorporated, where she collaborated closely with behavioral health providers. As I mentioned, from 2011 to 2018, she was the director of the statewide substance use and outreach initiatives at the Ohio Attorney General's office, leading efforts in naloxone distribution, public awareness, community engagement, and law enforcement coordination. Before entering public service, Jennifer worked in sales and management in New York City and Philadelphia. She's originally from New Jersey. She moved to Ohio in 1997 and now lives at Buckeye Lake with her partner, Tony White. She cherishes times with her sons, Colin and Caleb, and daughter-in-law, Maggie. She holds a Bachelor of Arts in Psychology from Stockton University and an MS in Psychology from the University of Phoenix. Jennifer, welcome today. We are looking forward to hearing from you.
Thank you. I should definitely shorten my introduction, but I appreciate all of that.
All good information to have.
I appreciate all of you attending. We're excited about this project, and I'm going to share. Once I share, I can't see anyone, so that's always throws me off a little bit. So if you have questions, I may not see you raise your hand. I'll ask, Wendy or Fran or somebody to let me know, because we certainly want to take questions from you throughout this presentation. We had actually hoped to have launched at this point, but there's been some kind of internal delays, lots of questions, and some minor tweaks that we need to take care of. So we always really want to hear user feedback. We did extensive user testing. So, happy to hear thoughts. I'm going to give you a nice little demo of this. And really happy to hear questions or concerns. We have 2 different email addresses that we can share with you if you have really one for feedback. Love for you to share with us. So I'm going to go ahead and share. Okay, so I can't see you anymore. So here we go. So I've kind of given the brief, brief introduction, but the service we have, it's called RecoveryRachel. And I'm going to show the next slide, which has kind of what that all means. It stands for Recovery Assistance for Community Health and Education Locator. Rachel is actually a person. I've known Rachel, I think, probably 15 years. I first met Rachel, as she describes, at a coffee shop. And her dad had asked the Attorney General, who was Mike DeWine at the time, was concerned about his daughter and asked for his help. So I met with Rachel. She was suffering from alcohol use disorder. She was pretty young at the time, and we met, and she is been in recovery now since that time. So it's very proud of her. She also has bipolar disorder. So she really covers kind of the spectrum of what this covers. And she works in the field helping people get into treatment. And it's really a lovely individual. And I think it's really quite well known in this space. She's done really very well. So she's very excited to have this kind of named after her, but it's broader than her. There's a lot of Rachels throughout Ohio. Some of the feedback, pushback that we received from folks initially was, look, we already do this. We have a treatment finder. We really keep good track of it. We know our local resources, and yes, local people do. And Rachel did the same thing, right? She would have a spreadsheet, and she had good relationships with people. So some people certainly keep using that, right? But where this will be more beneficial is, if you're in Dayton and somebody needs to go to Ashtabula, you're not likely to know who's there. So that will really help with that. And some local people, will still need it. And of course, family members and others will need help. So really what we learned, and I think everybody understands, is that historically people have really struggled to find treatment. And really where this came from is maybe, again, a long time ago when I was at the Attorney General's office, and we used to do kind of throughout the state these kind of big community gatherings. And when we would go, so many parents would say to Governor DeWine, Attorney General DeWine at the time, that he'd ask him, what would you do when you found out your child was using heroin, because it was more heroin at the time, and they just were lost. They didn't know, and oftentimes that meant that they'd end up somewhere out of state, or maybe at not the right place, and they felt really alone and didn't know what to do. So this really goes back a long way. And I know we've got a couple of Relink people on here, and they really stepped into this space early. And that comes up a lot too. Like, how is this different from other services? And I think as we go through this, we'll really show that. But I don't want to say anything but positive things about services like Relink. They've really done a tremendous job. They have lots of great resources as part of their service. We've really focused on keeping things updated with a lot of regularity, and because we incorporate AI into that process, we're able to do that. So, often things are outdated. And, I'll tell the story that when I worked in pharmaceutical, and I covered initially, I think, 10 counties, and then 4 counties and 6 counties. And I probably would spend, 4 hours a week just updating my database because of all the frequent changes that occurred. They change, they get a counselor and then they don't. They used to provide Vivitrol and now they don't. They provide just Sublocade, or they do different things. They had a doctor and staff, or they had walk-in hours, and now they don't. And in this space, if you're somebody who is looking for help, it's generally pretty important that you get it right away. And if you go and you do a little Google and you find a place and you think it's okay, and you go and it's closed, that's going to be your opportunity to say, it's probably not my day. And then you don't go. So it's really so critical that we provide updated information that's accurate, so that when people do their search, they find the place that really works for them. So we've tried to make this very nimble and easy. And also, when we did a big discovery phase where we looked at multiple sites, treatment finders, really throughout the country. And something that was pretty consistent was they were just kind of hard to navigate, and sometimes use language that like a mom, like, me would not understand. Might say things like, do you need intensive outpatient and buprenorphine? Well, I don't know what you're talking about. So we we really needed to work on that to make sure the language was easy for folks. Early on, as an example, we had a meeting with we spent a lot of time with Google initially, and when they first met with me, and it really stuck with me. They said, I hope you're not offended, Jennifer, but a lot of the state sites are so confusing. Why can't you just have a screen that starts with, how can I help you? And now that you have AI, you can do that because you can have kind of these conversations and help direct people. And I really kind of kept that in mind throughout the development to make sure that it was really easy for people. And they weren't like, what the hell? There's 17 things on this page. I don't know where to start. So we've tried to make it easy for them. So it can get very confusing. We also spent a lot of time having conversations, did focus groups with treatment providers, with peers, with people with, borderline personality disorders. It's alcohol awareness time, right? And we just finished a call with people that, suffer from alcohol use disorder. They were extraordinarily helpful because who knows better than them? And we don't know the language. We don't know what matters to them. So this has been very much designed based on what people told us they wanted, particularly in the provider area. And you'll see that when I do the demo, um, that the providers initially, said to us, we hate that you're doing this. We don't want this. It's just one more system. We do this for all kinds of systems. And now they're excited about it. And we're kind of surprised by that, but also happy about that. Because what we tried to do in designing this is make it easy for them and to update a profile is quick, it's fast. We pre-populated a lot of their information by doing kind of this AI scrub and then population. And as much as we could, made their profile fairly complete so that in many cases, really all they had to do was update hours and maybe availability of appointments and some other information. The providers currently in Rachel are only providers who are licensed and certified by the Department of Behavioral Health. That also really kind of adds to the quality of this. And we work with them pretty closely to make sure that we keep updated. They send us, if somebody's license was revoked, we get that information. We're going to remove them from the database quickly so that somebody's not going there, because we know that happens. So we worked very hard to build this based on feedback. I will show you Rachel. And I always worry because whenever you're doing a demo, that's when things don't work. I am going to bring you into our test site, but if that test site, because we're always making updates, has any kind of issue, I will switch to our live site. Not what I wanted. All right, I'm going to just switch. Hang on. Bear with me for a second. I don't know, Wendy, if you can pull it up, if you wouldn't mind.
Sure.
This is not Rachel being slow. It's her own internal state internet probably. Here we go. We're in staging. All right. So what you have a couple of choices when you are using Recovery Rachel. This isn't the main screen, but it's
Can you reshare your screen?
oh, I'm sorry. Wendy, are you sharing? Here we go. Okay.
Can you see it?
Yeah. Can
Yes, we
everybody
can see
see
it.
that? And then we'll just make sure sound is okay. So this is Rachel. You have a couple of options when you go in to talk to Rachel. You can also just browse providers, and we'll kind of go back to that later after I show you the chat feature and the talk to feature. So folks can make a choice. Generally, we recommend that people do this in a quiet area if you're speaking, because Rachel has very good hearing and she can hear all kinds of background noise, which has not always been fun for us when we're demoing this in front of a large audience. She will pick up what's in the background. We were kind of surprised because we think the talking piece is very cool, but most people said they would probably text because it's a private conversation with Rachel. So Wendy, if you can go ahead to the talk and chat.
Can you hold on a second? I don't think I hit I don't think I hit that
And the
sound button.
sound, okay.
So, yeah, hold on a second.
Just start it over.
Yeah. Okay.
Okay, we good?
I think so.
Right, we hope so. We'll do talk or chat with Rachel. Got lots of disclaimers, as you might imagine. Some more disclaimers. Right now, Rachel is for, we do not want children using it, although we can't really stop that from happening, but she's kind of trained on that. Hopefully in a later phase, we'll develop appropriate language for kids, but that gets pretty complicated. We imagine that most people will be searching for others, but who knows? Depending on which of these you check or you click on, the language of Rachel will change, particularly if you click on behavioral healthcare professional, because Rachel knows that she can talk in a little bit more clinical type language than if it's mom talking. So let's do I'm helping someone else, Wendy. Occasionally, Rachel repeats herself. She is trained to ask 5 questions, and she'll keep asking. She is.
Hi there, I'm Rachel, a virtual assistant for RecoveryRachel. I'm here to help connect people with mental health and substance use providers throughout Ohio. It sounds like you might be looking for help for someone you care about. Is that right? Hi, I'm Rachel, a virtual assistant for RecoveryRachel. I'm here to help you find mental health and substance use providers in Ohio for someone you're supporting. What kind of help is this person looking for?
I'm not really sure exactly. I just kind of worried about him, and he seemed really sad, and they've had problems with drugs before, so I worry that they could relapse.
I can hear the concern in your voice, and it's clear you care deeply about him. It takes courage to reach out when you're worried about someone. From what you're sharing, it sounds like you're concerned he might be using drugs again or having substance use issues. Is that the main area where you think he might need support right now?
I think so.
Take your time, I'm here to listen.
Um, yeah, I think mostly depression, but be good if someone also knew about substance use issues.
I hear you. It sounds like there might be a few different things going on. You mentioned substance use as the main concern, and it seems like there might be something else too. What other area are you thinking about?
Um, Maybe depression, and maybe they could use some medication.
I understand. So you're concerned about both substance use issues and something related to medication. That could mean needing help with managing medications properly or getting the right psychiatric medications. Just to make sure I'm understanding correctly, you're looking for support for him around substance use and medication-related needs?
Yes.
It's okay. Take all the time you need. I'm listening.
I think you have everything you need.
I hear you, but I'm not sure what you mean about a booking number. Let me focus on helping you find the
She's,
support he needs
can
right
you mute
now.
her for a second?
From what you've shared, it sounds like you're concerned about substance use and medication issues. Does that capture what you're looking for help with?
Yes. Yes. She was hearing some background stuff.
Thank you for sharing that with me. I want to make sure I connect you with providers who work with the right age group. Is the person you're concerned about a child, an adult, or a senior?
He's an adult.
I'm not sure I caught that. Could you help me understand which age group he falls into? Is he a child, an adult, or a senior?
He's an adult.
I'm listening. Is he a child, adult, or senior?
Wendy, maybe you talk since you're by her. You take
Take
it.
your time. I just need to. Got it. He's an adult. Now I need to know about his insurance situation to find providers that will work with his coverage. Does he have Medicaid, Medicare, commercial insurance? Is he uninsured, or does he have VA benefits?
He has commercial insurance.
Perfect. He has commercial insurance. Now I need to know where you'd like me to search for providers. You can give me either a zip code or a city name. What area would work for him?
Can you go with zip code 45324?
Great. I have zip code 45324. One more question to help me find the most suitable providers for him. Does he have any special needs I should know about, like accessibility requirements, specific provider preferences, or how urgently he needs an appointment?
I think it would be good if he got in as soon as possible.
I've created a search for providers and services matching your criteria. Thank you for taking this important step to help him get the support he needs. When you contact providers, it'll be helpful to have his ID, social security number, and insurance information ready, plus a pen and paper. For any appointments, he should bring his ID, social security number, insurance card, and a list of current medications. Would you like to access the search results page now?
That'd be great.
I wish you and him all the best on this journey. You'll be redirected to the results page in 10 seconds.
Okay. So we're going to do another talk with Rachel because show you a couple other examples. But this in this area, Rachel found one location, pretty large recovery facility to coach. You can see that the green is a verified by provider. What that means is that that provider has actually gone in, taken a look at what is in their profile and made any updates to it. And Wendy's hovered over that so folks can actually see when it was last verified. And Wendy, if you wouldn't mind clicking on to coach, we'll take a little peek at them. So they have updated their overview. We had probably already populated that, but they could go in and change. If any of you are providers or know providers, I'm going to give you a couple little helpful tips with this. We populated we have a lot of fields, right? And those really were based on a lot of our testing, the kind of the services that tend to be available the most, because it's a tough call. We can't have too many things in a provider profile because that means the providers have to update that. So we're trying to be, conscious of that, but we also have to say, well, a lot of people want to search for different things. So we are very careful in what we choose. We just can't possibly have every possible service offering as something that's a check mark. So what we've suggested to people is that in the overview section that they write that. We had a meeting with the gambling folks, right? Big issue in Ohio, lots of places. So they could write in the overview that they specialize in folks that have issues with gambling. And when Rachel does a search, she will pick up that and provide that back as a result. And if you can scroll down a little bit, Wendy. So you get a kind of a good look at some of the information that we asked them and by location. And you can even click on the map and get a better view of the location. Often there's pictures there. There you go. So you can see what they look like. People also add their own pictures. It's particularly important, it seems, that when they have any type of a facility where there might be inpatient, and if you wouldn't mind showing, let's look at Lighthouse. Go. So you can see, Lighthouse, I think, and I'm not 100% sure, but I think that they have about 800 beds in Ohio. So really good place for folks. And I think people kind of want to see where they're staying. So they've added a lot of pictures. It's really up to the provider to do that. We encourage providers to update, particularly as, walk-in hours change or appointment availability changes, to make updates. So this is a good one that has a lot of information in here. We're really actively working to get folks to verify their profiles. Sometimes takes a minute to make that happen, but we're pretty aggressively doing that. You wouldn't mind checking on specialty services, Wendy? You could pick another one.
I misunderstood because I was working
Oh,
with
no, I'm sorry.
specialty
Yeah, well.
counseling services, and I was
Oh,
thinking you wanted
yeah,
me to
yeah.
go and look them up. Sorry.
No, that's fine.
Okay. Sorry.
Yeah. So we just added, as an example, we did focus groups with folks we did focus on borderline personality disorder. So we had a focus group with clinicians. We had a focus group with family members. We had a focus group with people with the diagnosis. And from those focus groups, the one thing that really stood out was that there's a particular treatment that works for them. So we will be, if they haven't already, we're going to add that as one of the items on here. We can't add much more than that for those folks. I know they wanted a whole lot more. They felt Rachel was too friendly, for example. That they're the only group we heard that from, so we can't really change her voice. But we maybe at some later time they thought maybe it'd be nice to have a male person because their trauma may be related to being a male or a female. So as we move through this, maybe we can also add a male Ron or something, whatever we decide to call him. So we'll add that. into this, different things as we move through this process. This is really evolving, and we get lots of feedback from folks about what they think this should look like, and where we can. We do research to see if that's really something we should consider adding based on how many people might need the service. And then we will add it if appropriate, but we need to be careful. During our focus groups, we added, as an example, we also added if people had issues with domestic or violence, we added that in. We added faith-based services. So we keep adjusting and modifying, but we have to be careful that we don't add too much. We know that transportation is a big issue for folks. So we have whether or not they have transportation services available for people. And we'll keep doing that. So again, happy to hear from folks if you think we've totally missed something. And because that's really how we design this. Wendy, if you wouldn't mind going back in and showing a text, you can just run it.
Jennifer, I
Yeah.
am curious, what happens if no results are found within like the zip code? Is there like a radius parameter that Rachel uses?
I mean, the best, it will say, no results found. And the recommendation then is that you change your search criteria if you want close. What we are likely going to add, and actually came out of, it's a really good question. It came out of the recent alcohol use disorder. And frankly, me as a mom, right? I have a child who has suicide ideation and autism. And if I could find a place that helped him, I'd drive for 3 hours, right? I just need, I don't want to limit my search criteria. I'll drive because that's what matters. I need someone who can prescribe medication, and we'll go. So we're going to work on kind of some geo stuff so that we can expand that, because right now the way it works is you just have to kind of limit where what you're asking for Rachel to provide, and I don't think that's necessarily the best solution. So that's something that we'll work on adding. She does give a pretty, I don't know, broad, she'll give some recommendations. Generally, they are further out, right? If she can't find any close by, she'll give more. But I like the idea. So it does do it, right? But I really prefer the idea of the ability to say, look, I'll drive 120 miles, right? So yeah, we'll probably add that.
Interesting. Thank you.
Any other questions? Yeah, that just came up. I mean, we've talked about it, but then when we heard it, oh yeah, transportation. Some don't have, yeah. We've thought about, for example, adding are you on a bus line, but not everybody, has buses. But yeah, we have transportation. So when you talk to, maybe we'll do that one, Wendy, if you want to ask, say, well, I don't have a car, or maybe use that as an example so that folks can see what happens. She's pretty good at if you spell something wrong of figuring it out. You can also use this on your phone. I think most people, that's probably how they'll do it. There's your transportation answer. Yeah. So you can see that some of these, see, there you go. There's your none matched exactly. So it's giving you really closer matches. And so you can eliminate different things. But really, we want to be able to expand, like you mentioned, mileage. But if you eliminate some additional ones, will come up. And you can see some came up that aren't verified, but pretty quick up there is your Huckleberry House that is verified. We still recommend that people reach out ahead of time, like you would anywhere, and make sure of information. Telemedicine's a big one too, right? We added that because lots of folks who are pretty rural, that's a good option for them.
Do you want me to
Do
highlight
one,
anything else in this search?
anybody have any questions at this point? Because we're going to do one more chat and then move to some other things. Why don't you do a chat with Rachel again and be really troublesome? I know you can be.
I thought that one was a little bit
A little
feisty.
troublesome, yeah, a little feisty, yeah. And I'm curious too, is when you're doing this, so think about, give me your thoughts on something I'm thinking about. This is what we do. We ask, right? So we have a call. I have a call next week with the mental health boards, and you've seen a provider type. I'm thinking that would like to add the mental health boards, not as a provider, but in a similar way, because so that there's a lot of detail about that. Because like what made me think about that is that Wendy just typed, I don't have any money. So, at that point, maybe Rachel could say, are you aware of your mental health board? They may be able to assist you, right?
Yeah, that's
If
good.
somebody said, I live I don't need treatment. I need a bus pass, right? So, I know that Franklin County provides bus passes. So if they're in Franklin County, they can say, oh yeah, you can get one here. To kind of more support services. And I'm going to ask them, of course, right? Because that would mean they have to update their profile. But anybody can say yes or no. Is that something that you think would be helpful to folks? Or you can put it in the chat. That's fine.
And Jennifer, I can also
Yeah.
unmute people if
Oh,
you want to
okay.
open
Yeah.
it up.
Sure. Yeah. That's fine. Yeah. I mean, we're not talking to her, so we won't get all kind of feedback for Rachel.
Yeah, that makes it easier to keep the conversation contained.
Okay, give me a second.
We spent a lot of time. I don't know if it'll surprise anybody, but we did a lot of testing on the names of cities. And there's a lot of different ways that people say city names in Ohio. So we actually got a list from OSU of 1,200 pronunciations of Rachel of cities in Ohio that we had a linguist talk to Rachel about. Actually, somebody on staff at Department of Behavioral Health happened to be a linguist, so that was handy for us. We try not to spend money if we can't, if we don't have to. The big one that kept coming up was in a test, somebody said, I need services in Camel. Well, Camel is in fact Campbell, but the pronunciation locally is often Camel. So now she can recognize that, but you get really specific with AI. And there's been folks that are like, oh, AI, and so that everybody knows, we have a very strict policy and procedure that builds in a lot of guardrails. So, Rachel cannot, like the borderline personality disorder that I mentioned earlier, and we're going to add the specific treatment, right? So if somebody came in and said, I have borderline personality disorder, Rachel can't say, would you like me to find facilities that offer that the specific treatment? Because that gets too close to assessing. Person would actually have to say the type of treatment, and then she can search for it. So we got lots and lots of guardrails built in. So here you go. Here's your results. So we'll close out kind of showing you, Rachel, unless we'll keep it open for now, unless there's any questions from folks while we have the demo open.
And it is set so everyone can unmute if you would like
Okay.
to
Yeah. If you have any
ask.
questions. Or, we can always follow up with you and put something in chat. All right. So it doesn't look like we have any questions. So Wendy, you can stop sharing.
Okay.
Yeah, and then I will share. Appreciate your help. Okey-doke. So, some of our next steps. Oh, here's her hand raised. Kim, you had a question or comment?
Yes, I might have missed this, but if anywhere along the process of using the AI, Rachel,
Mhm.
and a person becomes frustrated with AI because this happens,
Yep.
are they able to ask to speak to a human? And will they be connected to a human?
Yeah, I mean, kind of. So I'll, I'll give you where we're at with that because there's, believe it or not,
Thank
lots
you.
of rules about AI bots connecting and making phone calls. So we have some of that legal stuff to work through, but yes, Rachel, what she should do is connect them to 988. Now, right now, we don't have a, all that she can say is, we, what basically she'll say, my role is to help you find treatment. You please call 988. Basically, that's what she'll say. What we're working on, we actually have a meeting tomorrow to see how we can connect them over, but it's tricky because you're coming from internet, right, over to 988, but they have a text service. So we have to work through those details. There are some contractual stuff and some legal things, but we'll work through those. But yeah, we want to be able to do that. But right now, I mean, this is just web-based, so we don't have people connected to it. We kind of feel that this is part of, I'll say, a continuum, right? This is very specific, right? She's a treatment finder. She's not going to chat with you, or which we don't want her to. Let's find you treatment. That's where she's at. Eventually, we'll add more resources, but we know that people get frustrated, and so that is the plan: is to get them to 988 more directly than we can at the moment, than just saying you need to call 988.
Thank you so much, Jennifer.
Yep.
Jennifer, you have another question in the chat
Yeah.
from Susan. How's this
Okay.
program being promoted?
Oh, well, good question. We don't have all those details worked out, but right now we're not promoting it, right? Because it's kind of a soft launch. We have providers going in and making changes. Fortunately for the state, we have a lot of ability to promote. When we talked first, kind of, we're doing some 988 work. It's interesting. This one of the things that one of our folks here said, there is not a state agency that can't help with this. Let's put 980 on all our envelopes. Let's put it on driver's license. Let's put it on all these things that people will see with frequency. And the state can do that pretty easily. I mean, for me, this kind of falls under that we have a lot of ability. This is a broad use, right? Very public use to get information out because we're the state. Recovery Ohio, we sit in the governor's office, so we connect. Part of our role is to work with multiple agencies to get the word out or find out about programming that can be done by Department of Insurance, Department of Medicaid. So we can work with all of our departments to get the word out. I will be on a speaking tour pretty soon once we launch. We work with Department of Behavioral Health. I know that they're committed to putting information out and in their newsletter. So really any possible way that we can do that. We don't have, if you worked in the private sector, you'd have a marketing budget. We don't have a marketing budget. So we have to figure out other ways to get the word out. And anybody wants to share it, we're going to have information we can share out broadly. Oh, thank you. There was another, I think, a part 2 of that question.
I think it's a different question.
Oh.
A compliment, great, well thought out resource. And then
Thank you.
how do the ODBH, behavioral health certified providers, make sure they're included in your database?
So we have done, gosh, I mean, so many emails out to those folks, right? I think the last time we just did one about a week ago saying, because now they can actually, it's a change of where they go make their updates. I think we had like a 40% open rate or something crazy like that. I mean, it's really high. We have made phone calls to folks. There's 2 things that happen. There's people can be what we call partially verified or verified. We had a lot of people kind of in the partially verified category. I think they thought they were fully verified, but not. So we called them. I mean, it's very important that we reach out and get them verified. They can always go to their licensed and certified folks and say, hey, I'm in there. I mean, I'll share with you at the end. we have basically two emails. We have feedback at recoveryrachel.ohio.org. We can probably get that out to you guys, and help at recoveryrachel.ohio.org. So if they want to email that, we can, get back to them if they have questions. There was another question.
Going along with that,
Yeah.
as a provider, if I do need to change or verify something,
Mhm.
how do I access it to do that?
We basically have a nice letter that we send you that gives you links to do that and instructions on how to do it.
Awesome. And
Yep.
if I'm a provider, I am not the
Yeah.
boss at my agency,
Yeah.
but if like we've been missed, is there a way to
Mhm.
contact you and make sure
Yeah.
that we're on?
Yes, because you know who opens all of those help emails. Everything that goes to those email addresses are opened by Wendy and I. So we're so excited about that, and we get lots of people. But yes, send us a note to one of those to help, or yeah, I would say the help at recoveryrachel.ohio.org. Use that one and just send us a
Yeah.
note and say, hey, can you check to see if I'm in the database, and let me know if I am, how I make the updates. We'll get back to you. We try to. I have a I've spent most of my career in sales. I don't know if you can tell, but and I I have a thing about getting back to people quickly, and I think probably drive the team a little crazy that way. But we've really tried to be prompt in getting back to you. Sometimes we get overwhelmed, but generally we're pretty fast. Any other questions? Okay.
Oh, there
I
is a
think
question
Steve had-
here.
Oh,
Steve,
yeah.
yeah. Asking about the URL to access Rachel.
So right now we are not heavily promoting it. It's a soft launch, right? We don't want to. We will get it out to you guys, but it is not yet public. So as soon as it is, we can ask Fran to send out to you and get that out to you.
We'll be happy to provide anything after the webinar, Jennifer, to the
Okay,
attendees.
great.
Just let us know.
Yep, thank you. It's important that we let our governor make the announcement before everybody else knows about it. So we're trying to be careful about that. You don't want to get me in trouble, so hopefully. Something else? Thanks. Okay.
Marie, I see, has her hand up.
I already asked. I just forgot to take my hand down.
Okay.
No worries. Just wanted to
Well,
make sure we didn't miss you.
Yeah, we're close to time. So, like I said, you have the emails that you can send to us if there's additional questions. So I'm going to kind of go through the last thank you slides. But I want to say to you, I appreciate really your questions and being on the call. So really, our next steps, we will continue to expand Rachel. It takes time and money, right? So we don't have a lot of either, but we're trying to be very thoughtful in how we do this. We want to add more resources. There's a lot of other great source, like I know that Relink is a great place for resources. We don't have that yet. So we may even suggest folks go to Relink for some of those things or 211, right? We want to expand our provider attributes. We talked a little bit about that, and that really comes out of focus groups that we're doing, and got some more lined up already that we will talk to some people. Hard to choose. I think our next batch of folks that we will get connected to are the workers' comp people. It's a really interesting area, and lots of folks have injuries, and it causes a lot of things: depression, anxiety, and sometimes drug use. And it's a lot of people. So that may be our next group. And we'll talk a little bit different. Veterans probably high up on the list too. We want to also build in here we don't have it done yet, of course, but We can probably pull out of this a lot of really interesting data. And so we're going to work on that. Rachel Outbound is actually Rachel calling. It's AI calling, but boy, does she sound like a person. A different voice than this, different system. She'll ask a couple questions. It's really to then take that information and feed it back into the system. So say, hey, it's Rachel. I see you haven't updated your hours recently. Can you give me that information? Collect it, send it back, update the system. We're going to add a complaint reporting system to this. We just had a call with the medical board, and also Department of Behavioral Health has a place where you can file a complaint against an organization. We want to make sure that folks are treated in the way they should be treated, and if they have a problem, that they know how to report that problem. I want to mention really briefly, because this is important. We don't have it. I'm going to add this also to the site. It's not on there now, but want to just make everyone aware and remind folks, totally different than Rachel, that there is this expedited pardon project. It's a big priority for our governor. It's really helped a lot of people. If you don't know about it, the link is there. And I don't know if you're setting the presentation out, but check it out. There are some rules, but it really trying to push this through quickly for those people who can really wipe the slate clean. It's a life changer for a lot of folks. We don't want someone's life based on the worst day of their life, right? So I got 2 minutes, so hopefully this was useful to you guys. And like I said, I appreciate Fran, you inviting me to speak, and keep our email if you have any questions.
Of course. Thanks, Jennifer.